Yes, thank you for the members of the committee for listening to my testimony here. My name is Dr. Brian Rogoff. I'm a healthcare consultant as well as a Maryland licensed optometrist, and very passionate about this particular legislation. And definitely feel that by requiring the state of Maryland, through interagency collaboration, develop computer health and safety guidelines in the public school system, it's not only to protect the children's vision, but further state safety, healthcare reform goals. Now, this is also very much in line with CPAC as well as the SHIP program to reduce childhood obesity. And a lot of the things that Ms. Eckert has stated are some of the things that I've been looking into over the years. And I also have an 11-year-old son who I take precautionary measures because we do not have the guidelines in place. Just want to let you know some of the health hazards that have been associated with the prolonged use of computers. As Ms. Eckert has stated, increased nearsightedness or myopia. Now, a lot of that time could be corrected with glasses, but we're seeing much more of an epidemic. In 2009, there has been a 66% increase in this, and some other countries are calling this an epidemic. There are many studies going on in China that are they're seeing this as well, and they're doing very focused studies on how to reduce myopia. Because the greatest health concern is the increase of severe myopia, which would increase the risk for serious eye problems like retinal detachment, glaucoma, and macular degeneration. In addition to this, some of the things that Ms. Eckert also had pointed out is the posture and the fatigue, and this is known as computer vision syndrome. And just some things that have been pointed out, sitting hours in front of a computer screen stresses the child's eyes, because a computer forces a child's vision system to focus and strain a lot more than any other task, so that's different than books, and can put the children at even greater risk than adults for developing symptoms of computer vision syndrome. On top of that, there's a lot of studies that have been going on with blue light, and this is something that I actually speak at different type of continuing education meetings. And one thing I do want to point out is that blue light is something that there's a lot of controversy over, that there's good and there's bad. As humans, we've always been exposed to this through the sunlight, but now that we're being exposed to after those hours really does mess with our systems. And we do receive these systems through the eyes. And artificial light sources emitting this blue light are compact fluorescent lamps, LEDs, and they're found in almost every digital device, including tablets, computers, and smartphones. And there's also mounting medical evidence that prolonged exposure to this blue light may permanently damage the eyes, contributing to the formation of cataracts and destruction of cells in the retina, causing macular degeneration, on top of other sleep studies as well. So thank you for your time.
Seeing none, that concludes the hearing. Thank you for your patience and your testimony. Thank you very much. We will now move to